Anna Marie here. She's so sweet. Nice to meet you. I'm Dr. Lee. She has some lipomas on her arms.
Probably about 10 or 12.
I just want to make sure that they're medically healthy. There are a lot of things that we deal with that are threatening to our emotional well-being.
I'd like to see them off my arms.
You know, I might not be able to remove all of these.
Just looking forward to getting these things out.
The more areas you do, the more potential you have to bleed.
Hi, my name is Anna, and I am from Modesto, California.
I have several lipomas, primarily right now on both my arms.
I have over 10 on one arm and probably as many on the other side.
It's not unusual to see somebody with a bunch of lipomas. I think that it is something that can somewhat run in the family too, in fact. I already, when I'm looking at her pictures, I'm thinking about how I'm going to remove these. How many of them do I need to remove? How much numbing do I have to give to them? You know, I might not be able to remove all of these. It depends on how big they are and how many she's asking about.
I've had them for probably about 30 years or so. I don't recall having any as a young adult. When I noticed them, I was well in my 30s.
Most people develop it more in their 20s, but I don't think that's something highly unusual.
You know, although this isn't anything that severe, it is bothersome to look down and see my arms all bumpy. And my daughter got married this July, and I was so conscious about what kind of dress I'd wear. So I asked them to make sleeves to cover what bothered me, and it made me feel better to have them covered and a little more relaxed.
Over the years, it seems to have been a little bit more noticeable. It's just something that I think more as a woman you notice, and like I said, you're wearing a shirt and they're popping out, and it's really unattractive. And quite honestly, with us watching Dr. Lee periodically during these last few years, it's been a lot of fun, and I thought that would be kind of an exciting thing to do if we were chosen. I'm really looking forward to it.
I'm here with my husband, Mike. He's my pillar of strength and support all these years. We've been married 24 years, and he's looking forward to seeing this.
I know her husband's here, and I think he doesn't mind watching these videos. I don't always like to have another person in the room because I'm dealing with one patient. I feel responsible for the other person in the room, but she seems more excited to be here than scared, and so I think it's gonna go well. Hello.
Hello.
You are Anna Marie.
Yes.
Anna Marie, that is, right?
Yes.
Nice to meet you. I'm Dr. Lee. Welcome.
Meet you. Thank you.
Where'd you come from?
Modesto, California.
Okay, that's not too far.
No.
And what can I do for you? You look really good.
I have all these
You don't
yuckies.
like them, whatever you have, huh?
These yuckies, look at.
Oh, that's a lot smaller than what you were pinching there. Oh, there it is. Okay, I feel it now. Because I thought I felt something else.
Yeah,
Right here. Okay.
Like, here's
Do you know what these are?
Yes.
One right there, I can see it. But they're not that noticeable, so that's good.
Yeah, I've had 2 of them removed. I had one removed here years ago.
There's a little scar right there.
Yeah,
I see. Okay.
and then one on my leg.
Do you know a little bit about lipomas, probably?
Yeah, just that it's a little
see.
fatty deposit kind
Yeah,
of thing.
yes, it's like a collection of adipose cells or fat cells. I like to say that it's fat cells that have just decided to clone themselves, like make an identical version of themselves and create like their own little fat colony. As regular fat cells, they expand. Mm-hmm. But these fat cells, they just create more of themselves. They work independently than everything else. So you may notice if you were to lose weight that you would see these more. They don't shrink. Mm-hmm. Some people are kind of prone to getting these, or it kind of runs in families. They're benign, nothing to worry about. I don't think there's anything that you can do to prevent lipomas from growing on you. I mean, it's not something that you've eaten. It's not something that you've done to your skin, but I think they just happen to people.
My daughter just got married, and I had to have them put mesh sleeves.
Oh, yeah. Oh, really? Just because of that? Yeah. So it bothers you. Okay. There are certainly some things we deal with that are life-threatening, but there are a lot of things that we deal with that are not life-threatening, but are threatening to our emotional well-being too. As long as you know that you're replacing them with a little scar instead.
Yeah,
that's
and
the other important
that's
thing.
fine.
The main danger of removing a lot of lipomas at once is the numbing medication, the amount of numbing medication you can use. There's certainly a limit, and I keep that in mind. In her case, I'm probably going to dilute some of that numbing medication. And the other is the more areas you do, the more potential you have to bleed. The more cases, sort of the more surgeries you're doing on somebody, the more risk you have of having a bleed or having a complication like that. This is something that we do under local anesthesia. So we're gonna try to see how many we can remove then for you.
Okay, cool.
Okay.
Thanks.
All right, I'll see you in a little bit then, all
Okay.
right? I'm excited for you.
I'm excited too.
Oh, good. Anna Marie here, she's so sweet. She has some lipomas on her arms. We're gonna probably do maybe about 10 or 15 of them, okay? We'll line them all up like our charcuterie board that we do. Okay? All right, great.
Meeting Dr. Lee was just great. She's just like, I've known her forever. She's as sweet as could be, and I'm sure it's going to be successful. I'm pretty excited. I feel fine. I feel relaxed, and they make you feel comfortable, and just looking forward to getting these things out. The healing process went fantastic, without any issues at all. We waited for the appointed time, took the stitches out, and they are healing beautifully. I'm very happy. I have gone shopping online, and I'm waiting for my tops to come in and to wear my summer tops. The days are getting warmer, and I'm gonna wear my new blouses with confidence and not look down and see all my bumps, and because they're all gone. So I just wanted to thank everyone. Thank you to the staff and the crew, and made it such a great experience. Dr. Lee, you're one in a million. Your professionalism, your precise work, I just am so thrilled that we got to meet everybody, and so thrilled that my bumps are gone, and I have my new confidence. So thank you for that. I really appreciate it, and we look forward to seeing you all soon.